Hi, Dr. Travis Rose here from Peak Form Health Center, and today I'm going to talk to you about when you should replace your running shoes. Now, this is a common question that we get from our runners and our triathletes, and most of the time we hear general recommendations of replacing your shoes every 350, 400 miles, or every 3 months or so. Now, in the office, we prefer to look at the shoe itself and then take a thorough history of the patient's running habits and any musculoskeletal issues that that person's dealing with. So when we're looking at the shoe, we're going to look at a few different things. But first, we're just going to look at the connection point between the upper here and then going into the base of the shoe. So we want to make sure that there aren't any tears or excessive stretching marks in those areas, so we know that the foot's going to be secure inside the shoe. So then second, we're going to look at the bottom of the shoe and look at the general tread here. So, running shoes, they have specific tread patterns with markings on it to know it's a new shoe with new tread. And over time, with our running patterns, that we're going to get patterns of wear that we can visibly see on the shoe. So we're going to look at that. And if that gets excessively worn, then what will happen is that then that patient's going to accentuate any potential asymmetries that they have in their running stride. And when it keeps getting worn down and worn down further, then the shoe's no longer going to allow the foot and the normal gait to function. And then that can cause decrease in efficiency, or it can cause some of these nagging injuries to pop up. So in a second here, I'm going to show you a more close-up view of the shoe so we can see the wear patterns and why this shoe might be time for it to be retired and get a new shoe. So this is more of a close-up view of my shoe here, and I'm using this as an example because I am close to needing a new pair of shoes. So again, what I'm looking for is, are there any tears or any excessive stretch marks along the upper here? So I'm going to go around the shoe, and I don't see any of that type of tearing or excessive stretching of the threads along those areas there. Okay, so that looks pretty good. Now what I'm going to do is look at the tread here. So in general, you want to kind of take a look, and you can see the specific tread patterns on the shoe itself. And then when we start getting over towards where the big toe is, you see some wear there. And then looking down the shoe towards the heel, you can see compared this side to this side that there isn't much wear here, but there is quite a bit of wear on this outside edge of the shoe and towards the heel. So this shows that I'm a little bit of a heel striker and into a midfoot strike, which I know that's how I usually run. And what I've noticed lately is that I'm starting to get a little bit of shin pain as of late, and I've noticed that that is something that does pop up when my shoes begin to excessively wear on the outside, because then it limits the amount of rotation the shoe allows my foot to go into, so that then my foot doesn't absorb shock as well. So that's a big sign for me that I need to get a new shoe when I see this wear on the bottom, and then I start getting a little bit of that tendon pain, which tells me that I'm not absorbing shock as well as I used to. Now, the last thing that I like to look at in a patient's shoe is setting the shoe up on a flat surface here. And shoes in general, they have a little bit of a arch on the backside and a little bit of a ramp up on the front here, but usually that movement's pretty smooth. Now, what I'll do is just kind of tap the shoe here. And what I'll notice in shoes that have asymmetry in the wear is that the shoe will start having these weird vibrations as I'm hitting the shoe. So it's not a smooth kind of forward and back, it's this jagged kind of shake that I'll see when a shoe is excessively worn on the bottom. So to reiterate some of the key points that I want you to take away from this video is that you don't need to replace your shoe every 350 miles or 400 miles or every 3 months. Pay attention to what the shoe looks like. So once a week or once every other week, take a look at the tread and take a look at the repair of the shoe and make sure that the shoe itself is holding up. And the other thing that you want to do to get more long-lasting life out of your shoes is to mix up the terrain that you're running in. So don't always run on asphalt. Try to find mixed terrain, such as a nice trail to run on, because then you're going to wear different parts of the shoe and you're not going to keep wearing down the same areas of the shoe. Now, the other thing you can do is use a variety of shoes. So, you might have one shoe that you'll run for your, go-to run on the asphalt that you do, a couple times a week. You'll have a trail shoe, you'll have a minimal shoe that you run for your track workouts, and maybe a maximal shoe for your recovery days. So by having a group of shoes that you cycle through, you're not going to get excessive wear into one particular shoe, and then those shoes in general will last a very long time. And then the last thing that you want to pay attention to when you're considering getting a new shoe is, how do you feel? So are you getting some nagging aches and pains? Are they starting to return? Maybe you're dealing with some knee discomfort, which you had in the past and now it's slowly starting to creep in. That might suggest that your shoe is no longer supporting your body and your style of running anymore, and that's time to get a new pair of running shoes.